Good morning, guys. I hope we're all sparkly. Ice bath done, gym session, run the dogs. Now it's time for admin at clinic on my day off. Where did things go wrong? Nobody cares. Work harder. I am here to serve. So yesterday we did a video about low testosterone and the fear. And I ended the video with my favorite quote from Carl Jung. For the hero, fear is both a challenge and a task, and only boldness can deliver from fear. And if the risk is not taken, somehow the meaning of life is violated, and the whole future condemned to a stale grey, lit only by will-o'-the-wisps. Wow, what an incredible quote. You have to keep going, keep moving forwards. And with low testosterone, you're pretty miserable. So you jump on testosterone replacement therapy and suddenly you're cured. The goal, hormone optimization. Is it a destination? No, it's a journey. So when we talk about earning your reward, what do we mean? Because a patient said to me the other day, how do I know I've earned my reward? Well, is it the outcome? Logically, you would think yes, but the answer to that question is no. It is not a destination. The outcome is very much secondary to the effort you're about to apply to achieve the outcome. So as Lao Tzu says, if you're living in the past, you're depressed. If you're living in the future, you're anxious. You must live in the present. So it's the effort needed to achieve the reward. And it's the conscious decision to apply that effort, and it's the sustainability and the hardship that ultimately makes that reward, which is an illusion because the reward is the effort, worthwhile. So when you see those young lads driving their daddy's Ferrari, do they place the same level of value to that Ferrari as they would if they'd earned it? No, obviously not. They did not earn the reward. The reward obviously being an illusion. So it's all about effort. Nothing more, nothing less. Sure, when you go to the gym, you have goals, and it's important to set goals. But once that goal's achieved, what's left? Nothing. So when you get optimized on testosterone replacement therapy, can you sit back and take your foot off the gas? No, because what happens when you take your foot off the gas? Yeah, things go wrong. Because what's it all about? A journey, not the destination. So jumping on testosterone, the cure, well, it can be the catalyst for change. It should be the catalyst for change, because it's likely that you've made lots of bad choices repeatedly, and you're sat in front of me because the outcome is low testosterone. So TRT is going to cure you. No, TRT is going to give you the foundation, and it's the catalyst for change. So when you were young, did you ever think about testosterone? Were you worried about your levels? If the sky was grey, was it because your testosterone was low? If you had the sniffles, is it because your testosterone was low? Life is hard. You need to be concentrating on moving forwards. Place your trust in me to optimize your hormone levels. Now, hormones are incredibly powerful. How do you make a hormone? Don't pay her. That's my one dad joke, and it's done. So hormones form the base. So as we know, there's a chronicity applied to hormones, a reactiveness to the brain, and acuteness to the nervous system. Without that chronicity, you've got no chance of being considered. So testosterone replacement therapy, there is a necessary titration process in achieving stable male androgen levels. It is a process, and you can't take shortcuts. I felt great in the first couple of weeks. Well, yeah, that was because the HCG was having a positive neuroendocrine effect. Or you felt anxious. Suck it up, buttercup. Yeah, you've had a peak and a trough, and you haven't achieved stability yet. So you have to achieve stability first in order to then say, how do I feel? Now, how do you feel? Now, your physiology doesn't care about how you feel. So what's it all about? Normalization of your levels to hopefully appreciate change. So consciousness, the subjective appreciation of subtle changes in your physiology. So you are going to get a drug effect in the first few weeks of testosterone replacement therapy. Does that mean everything's about testosterone replacement therapy in the first few weeks? No. What? for the love of God. So you have to crack on. Do not concentrate on the feels, because the feels, they come and go. We're achieving stability, which means hopefully sustainable positive change. And the glass can still be seen as half empty, but it's ultimately up to you to see it as glass half full. Every single day, every single moment, it's ultimately up to you as into whether you see it as glass half empty or glass half full. I can't do that for you. So what you shouldn't be doing is taking the path of least resistance, thinking there is a reward. Because what is it? Effort is the reward. There is no destination. That doesn't mean you shouldn't set goals. So a couple of my friends have just completed the London Marathon. Amazing. But it's over. So what's next? So we know that your male androgen profile follows a diurnal pattern. Day, night, day, night, day, night. Every day is an opportunity to do what? Be the best version of yourselves. So what are you at your core? Yeah, you are a hunter-gatherer, okay? So you should be waking up, being physically active to earn your reward, which is food, to then hopefully relax, hopefully have a bit of nookie, and then go to sleep. And ultimately, that's it. Repeat. So your physiology couldn't care less about your emotions. Now, your physiology can impact your psychology, and your psychology can impact your physiology. So we know that cancer patients do better if they have a positive mental attitude. So we talk about the fundamentals, addressing sleep, stress, nutrition, exercise. But mindset, again, is incredibly important. So that journey to hormone optimization. Place your trust in somebody that knows what they're doing and get on with life. Forget about TRT. You're having a bad day. Okay, get on with it. You're having a good day. Get on with it. It's that Roger Kipling poem, isn't it? If you can meet triumph and disaster and treat those two imposters just the same, it's an illusion. Get on with life. Concentrate on the fundamentals, not whether your testosterone needs to be raised, whether you need to control estradiol, whether you need to add in DHA and geez. Life isn't that complicated. Basics, testosterone, cypionate, and HCG. That should be the starting point for everybody's TRT journey. We are doing hormone replacement therapy, not testosterone replacement therapy. Some clinic tried to poach one of my patients the other day and offered him a free consultation. And this guy, doing really well. He's now on 12 monthly reviews because he's balanced and he's cracking on with life. But he was approached, it's a bit of a business opportunity. And so this doctor said, well, why don't we just try taking you off the HCG and then just see how you feel? And then what we could probably do is add in DHEA and pregnenolone and then titrate that dose according to effect. But why would you do that? That's utterly absurd. So the premise behind TRT is what? Normalization of your male androgen levels to allow you to crack on with life. So fundamentally, that's testosterone. And because testosterone suppresses the HPG axis, you give HCG because it mimics luteinizing hormone. So why would you come off HCG to then put somebody on DHEA and pregnenolone? Because you're trying to overcomplicate something that's actually very simple. And you're trying to sell somebody on the concept of, I've no idea. I've absolutely no idea. So fortunately, this guy approached me and we had a conversation about why that was utter fucking bollocks. And he's now got rid of them. And he's now happy as Larry because he was happy as Larry before. But again, we're always seeking more, aren't we? More, more, more. I want more. Now, there is no peace. So you have to keep moving and moving and moving. But you should be looking to people who know what they're talking about, not charlatans trying to sell you on a concept of, yes, you can achieve more by doing this. Because it's a lie. Effort is your reward. So, there's nothing more to say, is there? Apart from what? Go earn your reward.